give money out to help.
And it was a lot of it to do.
It's kind of
General comments, and so I was looking for. It was worth doing.
Yeah, I agree.
They were here a little bit, the panel, we were one of the sales, a lot of stuff, but I think it's funny each other. And that's the political piece of that, which is really valuable, but it's not quite as useful for me, even though we were as it is for others.
More asks than something.
Oh, Sydney.
It actually.
Sydney. Hi. Dressed down. Good, how are you?
I thought we were
I
gonna.
didn't expect to see you in person.
Yeah, I'm super interested to see.
I always like to,
because there's gonna be a work session.
I bet. Good. Yeah. Just right back into it. Jump right in, right? How about you?
Yeah, then it's.
Got it.
Your flight went okay? First, like that.
Yeah, actually, I was able to punch earlier.
Oh, yeah.
Sorry, as a standby,
Before I got into
because that's the flight I
question
had visually.
Yeah. There's a lot of ideas out there.
But I was 5 minutes late for the bus getting to Fort Collins, so that was all right. I got to do my business, you know.
We have a quorum. Okay. She's right there. Right.
Oh,
On Zoom.
Oh, I
She
see.
will be here.
Okay. I'm relying on her. Good job. I don't know. I have to write. I didn't know if there was a. Depending on the situation, I'll use one or the other.
Yeah.
Hey, Tom,
Yes, sir. We can.
I have a technician here. I'll be right with you. We're about done.
Okay. Excellent.
And I can hear everyone. Thank you, everyone, for, sorry, I'm on my way. I was meeting with Congressman Caraveo, and it went a little late, so I'll be there shortly. And to my colleagues who are at the conference, I brought the map, the posters, so I'll see you soon.
Well, wonderful. Let's call the meeting to order. This is the Regional Opioid Abatement Council meeting for Larimer County Region 2. This is Thursday, August 28th, just a little after 2 o'clock. Call the meeting to order. We do have a quorum for voting, and we do have our advisory members, a couple of them here, as well as online. So we'll start off with our first item of business, approval of the minutes for the June 22nd, 2023 meeting. Wait, I'm sorry, that's wrong. I'm sorry, the July 27th.
I'll move to approve the minutes presented as written.
We have a motion, is there a second? We have a motion and a second. All those, any further discussion? Seeing none, any opposed? Seeing none, all those pass. That passes unanimous. All right. Next order of business is public comment. Is there anybody that would like to make public comment to the council? You get 2 minutes to make public comment. Caitlin is online showing that they'd like to make public comment.
no, and we didn't receive any emails.
Wonderful. Before we jump into financial, no public comment for today. Before we jump into the financial report, want to get to talk real briefly about the agenda. What we'd like to do is item 6. We'd like to make sure we at least have 60 minutes. So the last hour of the meeting dedicated to the facilitated discussion and selection. We do have Angela here, a facilitator from the county's facilitation team. She works with Talia, who is unable to be here. So she's got a plan to facilitate that conversation, but we want to at least have an hour dedicated because it's really, really important on identifying our 2 to 4 priorities for the selection of the 2023-2024 award year. So with that, I'll move into financial update. Carol?
Yeah, you will see a financial statement and also attractive charts for your reading pleasure. And the statements haven't changed since last month. There have been no additional expenditures. And so at the last meeting, a question came up about whether this board needed to approve the financial report each month. And our attorney has said that, no, that's not required. He did recommend that we approve the report once per year, so maybe the last report. And then I did have one question for the council, and that is, I've been doing the report, the financials monthly. Would you prefer that I just do them quarterly?
Voting members, would you prefer monthly or quarterly?
I think if it's not too much trouble to get them monthly, it's good just to stay up on it and everything. And if there's no change, you can just let us know there's no change, but we can always still take a look.
Yeah, I'm really either way, it's fine with me. I mean, if there is changes, we definitely need to bring it to our attention, but if it's a month that there hasn't been any activity, I don't see much change.
Thank you. Trustee Mason or?
I would agree with Ms. Janssen. If it's not too much effort, I would like to see monthly continue if that's possible.
Commissioner, preference monthly or quarterly? Commissioner, did you hear the question at hand, whether you prefer monthly for the financial report or quarterly? I want to hear your perspective. I think you're on mute, Commissioner.
Monthly, she said.
Monthly?
Monthly.
We think we're reading your lips monthly. All right, I think that's the direction that.
We didn't know that you were gonna have to facilitate everything.
Well,
I appreciate your time.
Okay.
Thank you for the question. All right, any other questions on the financial report for Steve? Thanks for joining us again. We went over the financial report, really nothing new to report from last month. The question was, would you like to have monthly reports or quarterly? And fairly overwhelming monthly if that's possible, but we certainly want to hear your perspective.
Well, I think quarterly are fine from my vantage point. It's not that the changes are occurring that often. When we get, if we're distributing funds, when we get the new money, maybe if there's a change each month, if that wouldn't be too much trouble, but unless there's a change, I don't see any reason to do them other than quarterly.
Thank you. Appreciate that. All right. Anything else?
Okay, I heard two things. So I need direction.
The monthly or quarterly? We've heard kind of both. Probably in this case.
Should we take a vote or should we just go with consensus building? I think that if it's monthly and even if she just says there's no change, then if it's a quick 10-second report and we keep it as a placeholder in the agenda going forward. I mean, that's just in keeping it simple would be fine.
Yeah, and just to add to that, I think I would say you maybe just as long as the report is in the packet. I don't know that we necessarily, Carol, I don't necessarily know that we need like an actual report from you every month. Just as long as the physical copy of the report is within the packet, I think that would be sufficient.
I agree with that.
Looks like the majority would say monthly, but it don't have to have an official report just in the packet. Does that work?
Perfect.
Thank you. Anything further? Okay. Brief discussion of questions for legal counsel from the ROAC meeting. I'll turn that over to David.
Thank you. I think you've addressed one of them, at least partially. The longer discussion issue, and it's not even that long, is about approval of admin expenses. My understanding is this question was raised at the last meeting on, do admin expenses need to be approved? If so, how frequently? And the short answer is they have to some extent been approved in that a line item has been approved by this council for those expenses. Now that places a cap on the admin expenses, so that accomplishes the legal necessity of approving funds to be used for that purpose. The question then is it required or at least advisable to have some sort of review? And while it's not required because you've already considered and approved a budget cap, it was recommended or is recommended that you adopt some sort of review process just for oversight. As the council knows, but if there's anybody that's watching the live stream may or may not know, there is a potential state process just to double check that funds are used for the identified purpose. And so if this council is willing to do some sort of check-in and approval of admin expenses, whether that's quarterly, twice a year, or even once a year, that's totally up to the council to decide, but that would be the best practice and recommended just so that there's some double oversight to confirm that those are appropriate admin expenses.
Yeah, what I would like to do is to bring them to the council approximately every 6 months, just like I did last month. And it only takes 2 minutes for you to look at them and see what they are. I would feel more comfortable getting those approved by the council.
Thank you, Carol. Thank you, David. Any further thoughts on that? What I'm hearing is admin expenses, a minimum of every 6 months being approved by the council. Is that good with everyone? Thumbs up?
Good to me.
All right. Perfect.
There was one more issue that was raised, and that was just a question on the number of votes to pass. As everyone's aware, there was an added voting member, which now brings us to an even number. So the question is, when there are an even number of representatives on the council with tie votes, all votes require a majority to pass. So regardless of the number, you need a majority. So if you have a tie, that does not pass.
Thank you, David. Appreciate that. So we need a majority. A tie does not pass. All right. Was there anything else, David, or council
That's the list that I received. I'm happy to answer any other questions, or if you come up with a more complicated one, I'll go research it for you.
I appreciate that, David. I do. Any other questions for David? Not for me. We'll move
No, thanks
on.
for researching that, David.
I agree. Thank you. Okay, item number 5, a quick briefing on the COAG 2023 opioid conference that was held in Montrose. My understanding is Beth and Commissioner Shattuck McNally and good. And Cindy attended as well. So let's carve out some time here to give us some updates.
I thought it was good. Jody, were you ready to go?
Yeah, I can go or you can go first. Since I can get my mute button to work now, maybe I should go first. I don't know. So
Yes, please.
it's up to you. It's up to you all. And I apologize for not being there in person. So I had some photos, but I can start real quick if you can all hear me okay. It was great to be there with our colleagues, Beth and Cindy, and we really had a great time. There's a lot of great information. The rural track, the treatment track and the law enforcement tracks and the other tracks were all really well done, and it was really sometimes hard. There was multiple things I wanted to attend. It have the different regions present. I presented for region 2, and certainly I felt really heartened that the decisions I made and how we've gotten the money out the door. It's very heartening to know we're moving and getting things out the door and have our money being used to save lives. There's a lot of counties or regions that have RFPs and trying to get out and get grants and receive zero RFPs for people looking for some of these to do some of these things they need. So that was interesting, and there's a lot of folks that are still having trouble getting their money spent or allocated, and so that was really interesting to learn. Those are smaller rural counties that don't have as much money or have multiple counties involved, and so it's been a longer process. A lot of them use Stedman Group to help facilitate plans, or some got extra money to get plans. And I've heard privately from some of them, they feel like the plans still were not adequate or did really what they needed. So I think we all should celebrate that we've gotten money out and moving, and seeing some data back. And it was great to hear about folks with lived experience. I'm sure Beth and Cindy are going to bring this up, but it struck us right off the bat that we'd like to raise a question to the council about, do we really feel strongly about our advisory members who are so valued, and we were so glad that they gave up their time, but maybe we need to give them some stipend or some financial support, like the county does, and I think the state for Cons does this, to support their service on the council. That was something that was brought up. Folks with lived experience were compensated for some of their time. And I know there's a tax implication and some other things, but I'm sure Beth and Cindy, we all thought about this and discussed this, and wanted to bring this all to you. And I'll just add, I'm really grateful we could go. We learned a lot, we networked a lot, and we feel that next year the state conference is a really good chance that it will end up in Laramie County. So that's all I have to share. Thank you.
Wonderful. I did have a question, Commissioner. You mentioned that a couple regions were struggling getting the monies all out the door, I guess. Were those the smaller rural areas that were struggling?
Yes, because they don't have coordinators or programs to give money to. And so there's some that haven't spent any money at all yet.
Wow. And I did document our people with lived experience looking at being compensated. That is an equity item, and we can certainly put that in for an item on the next agenda or something. So thank you for bringing that up.
Yeah, and it was Beth and all of us brought it up. It's kind of a joint thing. And also, I'll bring the posters about the Connect Effect. Maybe Beth and everyone can share about the new statewide campaign for youth. So I'm bringing those posters. And again, my apologies for being delayed with the, it was really important to meet with the Congresswoman. So thank you all for listening. Appreciate it.
I'm glad you're bringing those. I left them sitting at home on my desk, so I'm glad you're bringing them. But yeah, the campaign, so they rolled out the campaign geared toward youth, and youth were involved in creating it. We'll be seeing it across the state, various formats, radio, social media, YouTube, all the things that are out there. So there's been work at the state level to get that going now. And then I really, number one, really appreciated being able to go. Being there, it was interesting because a lot of elected officials, but they also, and being on a council, the council and not being elected official, a little different perspective, but great to have many different people with perspectives there. You could tell there was a lot of effort to bring people's lived experience to this conference as well, and have some specific sessions where they led some of that. Cindy and I even joined for an all recovery meeting at the end of Thursday night in the evening. It was an optional thing. It was really, really hard. It was just a great experience. I really appreciated being part of that. And yeah, the idea about, and some of them are already doing stipends or some sort of compensation for our advisory members with lived experience. I absolutely 100% agree with that. And glad that you're putting it down for a discussion that we can make that happen, hopefully. And MJ and team was there as well. So they presented and are definitely seen across the state as, really experts in the field. And so it's great and makes me feel so grateful to have them here. And then also was very grateful that we have a 1-county region. There are lots that have several, like upwards of 10 counties in one region. And I don't know how they get anything done, one voting member from each county. So grateful for that. The only other thing I was gonna, there was I can't remember now what session that was in, but I put a star. There has been an example of at least one where they put aside some funds for emergencies or new things that come up. So thinking about, we're learning new things all the time, and thinking about setting aside funds in the future that we could use then to help with whatever might be coming up as emergencies. So just as something to consider on our list.
Did they say a percentage or how much?
I believe they did, but I didn't write it down, so.
We can find that out. That's interesting.
As with Beth, it was privileged to go, and it was exciting, but it was also very eye-opening to be there to really see how we're fortunate here in Larimer County, as Beth said. And also to Colorado was recognized through John Hopkins as for transparency in the state board. So that was, and the other states are actually looking at Colorado and seeing what we're doing because we are leading the way. And so that was very good to hear. A couple things that the Connect efforts that campaign is rolling out strongly, took some posters and distributed it to the schools up there and around. So that push is huge coming our way from the state. One thing I really thought it would be something to look into is that wastewater testing. You know, we did that with COVID, and that would be one way we could actually collect some data to see if the wastewater is showing a decrease in the opioid or other tests that we could do, just like we did with COVID. So I think that would be something that maybe wouldn't be too hard to implement since we've already been down that road. Also, I thought a good thing that the state is going to be doing is putting QR codes on the different Narcan handout. So that way, I'm not sure exactly how that data and what they'll be looking at, but maybe, you know, who's who and where, regional, how often, I don't know, but they're implementing a QR code on each. So I thought that was interesting as well as far as data collection. And yeah, I agree. The living is what they're wanting to be referred to instead of life. The living, getting some type of stipend or something for their time because it's so valuable. I really saw that at the conference. I think really in the forefront. It really helps us make our decisions and brings light to the different areas that we may not be thinking of. So I think they're a valuable resource that we have to be able to fund somehow.
Councilmember Olson has a question. Steve?
Yeah. Well, thank you. I just had a question, kind of a follow-up to the comment that there was a recommendation that we have a reserve fund set aside. Did I understand that correctly?
Yeah, I was just sharing that was what another region has done, and I just might recommend we put that on our list of possible ideas moving forward. Not first for consideration. Does that make sense? Just a certain amount.
Yeah, I can understand. Like for the city council, we have a reserve set aside for emergencies.
Yeah.
You know, the flood being an excellent example. I'm a little curious as to why we would need to set aside a reserve. What kind of urgency would we have that we would expect that we would need to, on an emergency basis, allocate some funds? I mean, I don't know, so I'm just curious.
Yeah, that's actually kind of the exact reason. It'd be like for unforeseen. I once, like, all of a sudden there's a huge increase of people who need
housing scholarships or something, and we only set aside a certain amount, and we want to be able to give some more funding, if that's something that we fund and we want, so just to have some flexibility, not to say that would be, I'm just trying to think of something that could be unforeseen.
And if I might, since I have the floor, and I understand that several of our folks that are not on the council, they're the what do they call them? Gosh, the peer advisors and so forth attended the meeting in Montrose. Is that true?
None of our, you mean the living
People with experience.
Yeah, I mean, as far as the stipend, we don't get stipends. I don't think, but I'd certainly, since I didn't make the trip there, I'd certainly donate my funds to cover their travel costs.
Councilor Olson, we're not talking about their travel to the conference. We're talking about just their valuable lived experience and participation on our council year round. Larimer County has that policy, and that folks can apply for, and I know the city of Fort Collins does. And at the conference, they had several folks they brought with lived experience from other regions, and it is a program that other councils are implementing, or regional councils too, as an exemplar for folks with lived experience to honor and value their participation, because a lot of us that are on the council are either coming as staff, paid staff from municipalities, or paid staff from the county, or paid our elected officials that get some kind of financial support. And so we just feel that the folks with lived experience are really truly volunteering their time, and this is something that was given as the best exemplar for the state and the country.
Well, the vast amount of funds I get for being on council, and I figure I get about a nickel an hour, so I'm not terribly supportive of that idea. So, my opinion.
Thank you for that. Marshall, did you have your hand up?
Yes.
Sorry, yes.
Yeah, I had a question about the QR codes. Could you explain that a little further?
I would love to. They just mentioned it from the Colorado Health Department that, we can call up anytime and get free Narcan or whatever they're distributing. But they mentioned that they are looking at putting QR codes on, I think, either the box or however, the packaging of it. And I'm not sure what all that entails, but it's going to help with data collection. But I will certainly look into that. And I just thought it was an interesting thing. I'm not sure how it's going to work or if it's even begun. I don't know. Do you know anything about
We
that?
have received some information from CDPHE.
I think that explains what my question was. I guess I was wondering if the QR codes were on the actual Narcan dispensers, right, or the packaging for the Narcan dispensers. And my quick 2 cents on that would be, as long as that's an entirely voluntary thing, it's not necessary to activate the QR code to get the Narcan.
No.
It's not that, yeah, good question.
Yeah, that is, no.
Keeping anonymity, right, things like the distribution of Narcan, I think is crucial, so.
Yeah, no, it won't.
Cool, thank you.
All right, yes. Councilperson.
Regarding the discussion Narcan, and I was having a hard time hearing, but I brought up an issue with what's his name on for the state. There's a requirement, and it's not a suggestion, but a requirement by CDPHE that there be training before people are authorized to issue Narcan. And it seems like that might be a little overkill, maybe a suggestion that people get some training, but this is apparently on the website. One of my other counselors looked it up and brought it to my attention that there is a requirement to be trained to administer Narcan. That may conflict with what we want to do with these vending machines making Narcan readily available. I also, my experience, when I went into for a medical appointment, they asked me if I'd like to have some Narcan. And so I got 2 packages of Narcan that I put in our vehicles, and there was no training, no questions, just here you go. So
Thank you for that. MJ, would you mind answering that? And we do need to move on to 6, so we really take the time on the facilitator.
Yeah, and I can chat offline too on this. We actually have 3 vending machines, Steve, and have moved through that training requirement by including training materials with every kit that is distributed into the community. And so they have the 3 steps to use. It's also on every kit, but there's also a QR code, speaking of QR codes, on the side that has a training video linked to it, and have access to those references as they need them.
Well, I appreciate that. And I know you have one down in Loveland at our
Yeah.
RPC, and appreciate that. It just seems that if this is a requirement from one office of our state government, when the other office is behaving perhaps a little bit more fluid, maybe there should be some change in instructions from a mandate to a suggestion.
Yeah, we're redefining what training incorporates or what training could look like, but to be very clear, those vending machines were paid through the state health department. And so if they were in misalignment with their practice, they would have told us last week when they came into them. So they are very aware of the strategy being used, but that is a question that's held nationally too. So I absolutely hear you.
Thank you for one more.
Just one quick point I wanted to also, that I learned is OPI Rescue app. And it's free. It gives you the direction on how to use it. And the 3 R's, I mean, it's a great app, so.
Great, thank you for that. All right, good conversation. Thank you for you 3 attending. Wonderful. I know Steve Wilson and I attended last year, was wonderful. I unfortunately could not make the trip, but if it's here next year, great. We can all try to attend. Okay, moving to item 6. This is the big piece. This is our goal for the meeting, is our facilitated discussion and selection of our funding priorities. If you recall last meeting, we had Talia Hirsch, who is a member of the Larimer County facilitating team, come in and did a lot of brainstorming on items, had a really good conversation, and that led to this packet, but 2-3 pages of it. Talia is unable to be here, but Angela Clarkson came in, and she's going to continue the facilitating, and I'm going to turn it over to Angela. So we were going to adjourn at 3:30, but so I've got you almost an hour.
Okay, got it.
Great.
We can do this. So I got a lot of information. It sounds like you guys came up with some great things. Talia put these all into 2 different categories. So really our goals in the next hour, a little bit less if we can make it, is we'll go over like just the meeting norms expectations that you guys came up with. Kind of briefly go over the overarching goals and things to consider while you guys are deciding on the top goals. You guys had quite a few that you did. And then at the very end, the voting members will vote. We were going to do it a little bit different way, but we have people on screen and also here. So we'll just do a round of kind of hand votes on the top 2 to 4 priorities that you guys come up with. I'm going to break you guys out in groups so you can go over and have good discussions around that piece and come up with the top 4 you want to bring back, and then we'll kind of combine those and let the voting members vote. That works. So meeting norms, expectations, and values. You guys came up with respecting various experiences and knowledge we all bring to the meeting, listening to each other's ideas before responding, step up, step back. I'm not sure what that one is, but you guys probably know. So if anyone wants to tell me what that was, does anyone remember?
Yeah, go ahead. Speak up when it's your turn, and then as you set enough, step back so others have space.
Perfect. I like that one. That is a new one for me. If you don't understand something, speak up and ask, and assume good intentions from everyone in their discussion. Really overarching goals, things to consider is using funds in a manner to actually influence statistics of use and overdose deaths. Build on the relationship with the VHS facility, stretch funding to create largest impact in the community, delineating between prevention, treatment, recovery, and supporting all three. Sustainable versus one-time programming, and kind of thinking of that when you guys are talking about your overarching or top priority goals. Affect as much of the county as a whole, not one specific locale, so including rural to urban as well as towns. Equity, diversity, inclusion lens, focus on those disproportionately marginalized. Looking for significant gaps and collaborating and leveraging work with the work partners are doing already. So I know some of those you guys kind of already did when you created all of this. So your next page, so you have two. So Talia did an amazing job of creating this. She put it in categories under prevention, harm reduction, treatment, and recovery. And then that last page, and then page in a tiny bit, was another way just to categorize. These are all the same things that are in the chart. It just categorizes them under judicial system, youth, sober living, training, awareness, education, expanding, supporting existing programs, peer support, increasing safe spaces, and prescription and demand of opioids. Around that piece. So don't think you have to go, when I first looked at it, I was like, oh, this is a lot, but really it's the same information, just categorized different ways. So really, I guess if we have questions around any of this before we start, and then I think breaking out into groups, I'm thinking we can shoot for 30 minutes to discuss. You guys might get done sooner. Really, I'm wanting to guys, I have sticky notes if you guys want. I have little stickers that you can put on your pages, but really have one person kind of refer to your group of the top 4 to 5 you want to bring back for us to vote on. And or you can just circle it on your thing, and then when your group is done, you can bring them back to me, and then I'll put them in a thing so we can share on the screen and have people vote on it if that works.
I do see a councilperson Olson's hand raised.
Yes.
Yeah, thank you for that. I just need some clarity on the under the harm reduction, increased mobile presence capacity in Loveland. Is that for needle exchange?
I'm not seeing that under her. Oh, increase the mobile presence. I will put that back to you guys because I was not at the last meeting, so I'm not sure where that came out.
If it is needle exchange, the consensus of council is we don't want that in Loveland.
I think it says increase access to medication, so I'm not sure if it's you.
Mr. Chair, I don't think we've had a consensus here that we're against that. I think that as a council, we've been in support of that because we did fund part of that with our last funding, I believe, right?
I think the question was, I'm trying to remember
But
that one.
the mobile presence includes needle exchange. I think it does.
It does, yeah. So that's it. Yeah, so, councilperson, I do believe that does include not only access to medication, but clean syringe, access to clean syringes.
Well, okay,
Yes.
but my point is the council in Loveland, that's not something we embrace. And so that's not something, we do not want needle exchange expanded into Loveland as a council.
And I think this is one of all of these, so as you guys break out in your groups, you guys can definitely decide if you want to put those in top 4 or 5 and then have that as part of the council voting if that works. And I know with the amount of people on Zoom that I'm wondering if we can just do a breakout room. Are we able to do that? And where you guys can do a breakout room and then you guys can come back in when you're kind of done of going over that. Do people have questions around kind of what you guys are going to be doing, what discussions you're having, and then I'll get you guys in breakout rooms in here too.
So on Zoom, it'll be 3 people.
To be Christina, Brian, Steve Wilson, and then is David part of that too?
Most likely not, he's the
Okay.
legal counsel to the.
Okay, I wasn't sure who, so
Yeah,
yeah,
okay.
so for you 3, you can do a breakout room and group and really have discussions around those pieces. However, you guys, whichever one you decide to look at, you can, and at the very end, when I put it in, I'm gonna put the top ones in a graph like this. I can also put kind of the other back category, because I have those all created of where they are. So like if you, just to kind of see that when you guys are voting, when you're discussing it, it's not all judicial system or all expanding, supporting existing programs, and you have a balance in that. So I will put those initials up next to that too. Yes, Christine?
I had one idea before we started, since we had a category for youth. I started wondering two things. Do we need an adult category? I wondered because as I look back at our statistics in our county, and I understand we must be youth focused because of our education program and prevention. And then I did do some looking at the new ad campaigns from behavioral health, all those things that are posting online and on TV. And I got some feedback from people posting. I wrote down the most common threads I saw on 3 social media sites. And the biggest fear people are talking about when they're not seeking help, I just wanted to add this in, I hope it's okay. The biggest fears people are talking about, mostly adults and families, is the red tape. It prevents them from asking for help or from seeking treatment. The fear of getting involved with the new behavioral health systems. And a lot of people are reporting no follow-up once they get out of the hospital and the judicial systems. So I'm hoping we can think about that a little bit.
I do appreciate that feedback, and I think just from when I looked over a lot of that will follow into the categories you guys already came up with. I think today we're really just doing the overall 2 to 4 goals, and then the nitty gritty of some of those pieces will be, I'm sure, throughout the next year, from my understanding. Correct.
So that just made me think, should we have adults? Should we have youth separate, or should we have adults and youth? And I thought maybe MJ might know.
Yeah, and I know but that is just kind of another way to categorize it. So if you guys want to add, if you want to switch things around to those pieces, but really I think the main 4 will be prevention, harm reduction, treatment, and recovery. It's just kind of understanding the youth and the adult piece. When I was reading through, there was some adult ones for sure in here too.
Yeah, it is.
Yeah, so I don't think those categories were just something Talia came up with a different way of looking at it. I think we still would have you guys know better than myself around those pieces of being able to make sure there's adult services in the 4 main categories.
And then I totally think, even hearing what the people brought back from the conference, definitely focusing on existing programs. I mean, that's what I think is lacking in the rural and the smaller communities. Like, we are so blessed to have all these existing programs. So that's my 2 cents. It's wonderful. This list of people.
Perfect. Mr. Olson, councils. Councils. Did you have a question before we break out into groups?
Yes, just for clarity, are we to go through the table here and indicate the ones we support as goals or priority areas, or just pick 4, or what was the number? It's hard to hear.
So as a group, you're wanting to pick your top 4 to 5 priorities, and then we're going to bring all the groups' priorities back together, and then the council will vote on them.
Okay, thank you.
So your top one, though, just, the ones you really feel like are the main areas to focus on in the next year. Any other questions? So we'll break out into groups. I think there's a way in your groups you can do chat. So if you have questions as you're going, you kind of, Caitlin can help me see that piece. And then as far as breaking out in groups for you guys, do you guys want to do 2, would be 1, 2, 3, 4, 5, 7 of you guys? Or hit all you guys. Okay, why don't we do, I feel a little kid, I'm adding things. So we have about 11 people. Let's do 3 groups of 3 1 of 3 and 2 of 4. Not skilled or
And I'm not
high.
going to participate, I'm just fiscal.
Okay, so we'll do 2 groups of 3 and 1 group of 4. So if you guys just want to do kind of a cross, get in, do you want me to pick groups?
And I'm bringing one back in after 30 minutes?
Yes. That should give us time to vote. If you guys get done earlier, bring it back your stuff. If you guys want sticky notes or these in the paper, or you can circle it on and join us. Have one person do it. And then I don't know if did they get copies? Yeah.
Who wants
You guys get copies of what was.
Who wants it?
Probably.
Let's
You so that we have. Yeah.
That'd be great.
I'll walk over here and see where I land.
All right. So there's
All good.
there's.
Well,
Hey, right here.
Good. Hi Jody, hi, I'm Deb.
That's love ones.
When I first got the equation, I thought it was level, and I'm like, oh, it's perfect, because I last worked out 10%.
I saw it.
All the way back here now.
If you guys need, I have. Do you guys need an extra copy? Since you guys have a couple people, I have 1 extra copy of things. Or whoever.
Like to work off the table or?
Here's things.
Like the table, but I'm not super neutral. Wanna work off the table or what?
I was doing a bunch of stuff.
Uh,
Working this side of my brain.
Even sure.
It's the table. So the table is important.
I don't see any buildings on the back side of the table. It's crossed it up, but I don't see it right there.
We run to the table.
So that's what
I don't know how you feel about that.
Everything.
That was like a.
Technically not.
I know I brought it up last time.
Pleasure. That's funny. I
Yeah, we were all over the place.
That would be my intent. You guys are aware that that's gonna filter my volume. Like I had.
So I just wanted to. It is fire. It is, yeah, so. Bring that back in here somewhere, would that be prevention or would that be harming?
But I feel like education and prevention.
So like the intent of giving our shop and benefits, they're not paying on it. A lot of the towns, people in addition, like insurance.
There is by then there are places where like this costs money.
Where would you be?
I think we need a grant. That's ideal, but if they do need funding,
Yes,
Funding for them.
The whole group talked about this, but I know I brought up at the last meeting, talking about continual co-responder program, and I don't really feel like that's adequately caught on this doc, any of these documents. We talked about co-responder programs and felt like it wasn't
have to. So I feel like maybe under harm reduction and co-responder programs. Conditions about law enforcement. I don't see how you
Okay, so we can,
go and maybe, I think it'd be under harm reduction, and add that all to all the groups to have that discussion about policy.
I'll reach out. Okay. That was co-responders going out there.
Yeah, and continuing to kind of the program of the co-responder. That was the things I meant to say. Okay, let's get part of this one.
Oh, it's on here.
So I guess the goal of this discussion is to.
That would fit in. Identify gaps. That would be it.
Yeah, oh, right.
Oh, that's excellent.
Yep.
How does that work?
So then I'm like, discovery, is that what that is?
There and the. Here.
Skill training. It's not like. Lesson that they have.
Kind of involved, right?
Yes.
It's not, I mean, this is a one to one, right?
Yeah.
Right. Even here, you're still preventing. And there might be. That's how it is. Now, graduate twice. It's very fluid.
I mean, I've been years, but I'm still just. But I'm also.
I don't know when it's officially. Treatment to recovery, but yeah, but because you're so much. And then isolation too. Ongoing, actually, really supporting all of that.
Harm reduction aspects requirement. Right.
About the importance of harm reduction. And often so there's one laptop daily, so harm reduction, you have explanation of the co-responder.
Not that people have to do it, I just like.
They would like that very much. There was one that was left off that they felt was important to have on there is the co-responder communication, to continue to have co-responders while we're first responders under harm reduction. I have this apartment on my garage coming as well, and I should obviously support that as well. Yeah. Thank you.
I really, when you look at the social determinants.
Yeah, they're not certified.
No, I do. I keep quoting that.
And I think that's. Yeah, that is a massive. We don't really have that. We don't have residential treatment.
That's why we want to.
Yes.
I'm not talking about reason.
I see you wrote that together.
Could that transition
Do much.
Well, I know initially, but I mean, it was also.
Yes. Sort of the same places. Back to this.
Oh, really?
Yeah. So, but we use some, just places that we like to do
Expansion should be good, I think, several surrounding.
United Way. I agree. I
So I mean.
can't recover tomorrow. I mean, somebody who are recovering, you feel isolated.
I lived on 5, sounds like we all kind of, I don't remember actually. But it sounds like these two are kind of. The treatment focuses on using.
I think that the ones where they're talking about the field like there's a lot of that coming, you know, there's like
Oh, it's, we could spend time.
Yeah, I started looking at it, I run, like, no,
So there are.
employees, customers, revenue, everything else, and start putting it in categories and then.
Programs for kids.
We can do this. We can do this.
Feel perfect, it's based all about.
So it's a good reason to maybe bring that forward is because. And make this like getting back.
No.
Because then that's gonna be what's left. So it's just top priority that we're.
Are engaged in the children's
They
library.
wonder, you know, how they get, we are gonna have. Right?
Make sure on the 4 million.
3 point something, 3.4. Yeah. Well, then they have to.
Dump that in.
Categories of places we so I don't see anything in this part.
Yeah.
Right, so we can kind of lump things.
There, or if you guys want to circle one of your dates and just get that to me either way. They're doing kind of like, have that circle and then X out with the already, whichever works best for you guys. Flexible. Like a little messier.
I'm a little messy.
And I can see, I mean, the addiction is not.
How is that? So the environment, the work. License.
Or, I guess not all provided. I'm telling them, it doesn't say tell them, but it's mental health.
It's just very different.
That's just my.
I just think, yeah, I think both are. Because
And they're on.
they're hard, just to, so.
Meeting size.
Pretty similar programs at the option.
Smaller,
So those all
individual.
if we're talking about.
What?
So I think that one is. Paying for about 6 hours. Supporting programs, support groups, leaving, recovery.
Do we go ahead and just have a grant application?
This council doesn't have to pass.
No, so do we give those vouchers?
I feel like
I don't know what that looks like.
10% go,
That was
10 to 15.
I was about to raise my hand.
Then it goes.
Since we costs. Okay.
Right. Work for it.
But I'm saying if we consider it as one of the categories.
Right, or Medicaid things. And that's all for. Yeah.
By then, they don't.
I mean, I think you could just have a category for yourself. I mean, to me, that's a little simple to then say, then we would propose the current grantees, that because many of them have a variety of programs to address people coming forward with these issues, where there are more issues still. Substance use disorder, stabilization, harm reduction. So we're not.
Yeah, let's do that, just so it's clear for both, because that question came up.
You know what I could see happening actually though, is maybe not like around just for one.
Yeah, I think I would like to see.
Be able to figure out that array and continue. And I can see them raising their, I mean, because they do it now for, like the student funds.
Yeah.
They help funds.
Guys, we have about 12, 13 minutes left. That is good, we can get on And if you guys have yours already taken, you can bring them to the office.
Yeah, stay with it, I don't see.
Correspondence with that person. So I don't. I'm not sure what to
No, that's for she now. It wasn't that we didn't discuss it.
Partners in two. And go for the state money.
That is, but I do believe.
The amount has changed. This one, so the VHS license.
Yeah, it is.
Yeah.
So I think
I want to make sure we.
so it needs to go to a white. What we know we're spending on it, then what's left.
Don't even know how to get it.
That was one of our big concerns, like, was left summer still. Going into.
Even my clients. saying, continue.
Instead of max, instead of forcing total max, they're saying like, yeah.
Hours into that. It's fun. I'm still grumpy about it, 6 points.
I know, that's why.
I don't even wanna talk to anybody in the city office.
Official rules.
We're getting every bus. Much better work.
That's not right. And I said,
Yeah, portfolio.
I feel like they're breaking garbage. And she's like, oh, we need to talk to some. I talked to her.
City gardens.
So I wonder if like that.
We have the right number. Just give us how we define it. Okay, I think.
You gave us an exercise and we're breaking.
Parents and ex-advisors, and then that starts to work together.
So it's like not
Increasing
so
social connections and safe places.
Yeah. We're gonna have these two drivers. One to kind of keep our other ones that we saw.
Communities.
So not one of them, but step it down. So that's decided to continue.
Doesn't mean just a, it means all.
That looks like. Then we have a category of giving, putting out there for grant or for vouchers or money for housing.
Yeah.
Then we
Because it's
have
both.
targeted RFP to combine or look at.
Well, I see it, it's not this one.
Yeah, that's what
I don't know if we need to define it now. Grants towards those.
That would be great.
Right.
Again, right?
And
Because I don't want people to get hung up on, oh my God, our police are really hard. So we want to cost that. We always have to talk about the concept, but it's not the mechanism to get to the concept.
I mean, that's good to have. I love data.
So I think what we have is two different things. We've got that math problem that I was talking about working through. And then we've got one of the 3 or 4 defined areas that focus on whatever funding.
5 minutes or so.
We're done.
Okay.
But I mean, this is really the math problem. But then from there, what we have to report back on, what are the categories, what are the spending outside of that. But I just.
I was gonna say million here. Let this
And you can talk about that again.
Hey, start.
But it's not.
Oh, it's mainly the top like ones is the house. That was it.
I got brought up first off.
I know, but. Pick four.
I think the most
Alright. So the interesting thing about this book is that these 2 things are gonna fall into this. Because they're already currently being funded. So they're not new priority areas. They're
Days off.
Right.
So we're great.
Well, that's good that our.
Just done Friday or Thursday of every month. It's 6:1. It's usually at 2 o'clock in the afternoon. I just switched to 12:30. Then I can make
Which 4 you want to, that's our housing, that's our youth, that's our, just the.
Yeah, it's.
We do that.
Overdose. Yeah.
But here's the question, because how much funding are you Yeah, but I don't have just got started. That was an important thing for that.
Thank you.
Okay, these two, where were they at on that? I was trying to, there's a few different ones I can fall under,
So that's where I was, so this one. On the ongoing, which is good to see, yeah. And so it's like also a natural part of the process.
and tally them.
And then Jason first consider, because how many of those
So
things?
that's,
Would you have to take out one entire of those 4 funding streams in order to make the math work?
Like,
And I would prioritize our staff.
Huge. That was huge.
So that would be the thing that you would want to be ruminating on.
that's what we
A
thought.
lot of it.
Some of this we could add in as activities, so
As well as-
one or the other, so. Thanks.
That's why the school started to cool down.
tomorrow is gonna be a nice big exposure. Or like.
That's our shop. First thing in the morning.
Which is great. There's money flying around, just great. Kind of telling of copy and pasting.
Are we sure? Sorry.
I'll be happy.
There was some that housing that's where
Did you quite like?
Yeah, I think some, there's like, you guys will get behind those.
It doesn't really matter to me.
Can't think we're doing the western shores like Michigan and stuff. Yeah. So
I think it's good.
never spent much time on there. I've just heard how beautiful.
You gotta try and make it.
We're about 10 minutes away.
Okay, you have 6 minutes.
We gotta roll it.
Do you guys have something now? Yes. Jeez, it is Make my facilitation skills look poorly.
So we're proposing.
Every time. Right, they.
And then.
I was trying to.
You combine those in, like, because these are really overarching goals, you guys are getting into all this nitty-gritty stuff within the next year. That's not really part of this piece, so I think the ones you want to continue to want to do like your top 4, some of these will probably be combined anyway. And then it's part of your.
Whenever.
You can do that.
Sounds like a really fun place for kids.
Yeah.
In the overarching, like. Okay. Sorry, and it's hard because I wasn't in that piece, so if you guys,
What do you think?
I can kind of talk with them of how you guys want to move forward, but I think if we can. Yes. Okay. I know time will help, I be like, this is household entrepreneur, and when I do a vote on it, there's all these things. So, do you, which ones do you? This one, co-responder. So, these people are using my.
And then we want. I'm not sure the access.
So this one, co-responder, that one, this one. Okay, and then I use them really quick. Programs were discussed.
Slightly more focused.
That's pretty nice to know.
That's not city college, I guess.
I targeted, there was a bunch of continuing things, which I thought in there.
That's like usually.
Just bringing that up.
Yep.
Yeah.
Our service.
And yeah, possible.
And I think that's like you guys will decide.
Yes.
Really focus on that.
My second
Here's
favorite.
real quick, so you have. You have yours. Guys, will bring it down, so I can tell you that.
No way, stay there. Right in the center. You got a spotlight coming in. How are you?
Let me write it down to have some of this. Okay, so
just curious.
So
we also are going to show your assumption, you were actually to have an experience with.
this isn't about funding, it's really the overarching.
probably don't.
goal.
It's a great
If
idea.
that, we will never.
It's like your dollars, like, okay, gift cards,
Yeah, totally. I find somewhere good to use those funds. I appreciate being able to be of service to this council, but I wouldn't say no.
I just think it's,
I like the equity part of it,
yeah,
you know?
it's important.
Okay for vouchers,
Treatment. I know you guys are gonna take care, but you know what I'm saying?
Give mine away.
That's
It's not everyone would be in your situation, right? Someone might really, they might have to sign off and don't get staff on figure, so someone else, the ability for others.
If they cut us checks, you know, go shopping and hand out food and things to people on the streets, how's that sound?
I'm just saying, it was really,
Yeah.
it was an important point, so.
I agree with that, and I think the equity it brings is important, and, further, you know, down the road, there may be others where it's a really important piece of them being able to be involved, you know?
Okay, guys, let's
Yes.
kind of come together, and I just want to kind of reiterate that I'm gonna pull this up on here of like the top. A lot of them had one vote, a lot of them had two. We'll pull them up and then kind of do, I think, a vote. I know we don't have a lot of time for discussion. I know you wanted to speak really quickly about that piece, and I think just looking at, these are the overarching goals that can include existing and future ones. All the funding, everything else will be discussed at a later time. This is just our 2 to 4 overarching goals for the next year. It doesn't have to be new, it can be existing, but it's the overall theme of things.
So I just, as we were sitting looking, I didn't feel like we had our existing, I didn't see them in here. And I feel like, we had a lot of success, and I don't know if my colleagues were at the conference. It was very apparent as we did those direct grants, we got money out the door, we're moving, and others are still struggling. And so we talked about this a lot, about still sticking with some direct things and maybe not doing them one and done. We just got these programs going as MJ, I think MJ and Sandra figured exactly, so you just expand to expand. And MJ, we told her go big and go rural and get expansion, but now she's expanded, and that also takes money to keep that expansion going. So I feel like in the co-responder, we only have access to the data. If we're not finding them, we can't have access to the data. I sure would like to see how this system is rolling out. So my proposal is to have some of this money to fund at a lower level, not what we have, but a lower level of what we have existing, just to kind of keep them rolling so we can kind of support that, but then also have, we've all talked about housing, so have a housing category to kind of put some for either grants or a grant or a voucher specifically, and then have a smaller targeted RFP for these other categories, like it might be youth innovative programs. We have some major gaps, and maybe that's where we put in for an RFP for someone to have to go big and go home to address this huge gap in our community for youth treatment and mental health initiatives. And I know the county's working on that. And I wanted to also bring up that the behavioral health grant is almost ready to be awarded of $2.8 million, and some of there's an overlap here. We have an opportunity that we don't have in other places to maybe look at how we can ask someone to maybe look at bending and blurring funding going forward. And we did not apply as a council. We had some conversations, but we didn't even try to go for these state capital funds or innovation funds. And looking at some of the awards, that's one thing I forgot to share, looking at those awards at the conference, we all like, why didn't we apply? Why didn't we apply? And so I think we need to have a conversation of how we also go for those extra monies, because I think we're primed to expand and even get more money for the region. And so those are my thoughts. As if you think about this, because I don't see the access and intervention and intervention with MJs or the co-responder here, and I felt like our current programs weren't represented, and I wanted to kind of keep them partially funded and going forward, so we don't lose access to watching how that goes.
Can I ask a quick question, just I know we have literally 10 minutes left and you guys have to.
I know.
As far as like the funding and existing, just from reading this and again, I guess asking the group, could those be put under this? These are very, very overarching goals. It's not the funding around it. You guys will have those discussions later. You'll have all of the other pieces later where you can narrow these down to the different programs you want to do. Thanks.
So we talked about this in our group. When we look at probably almost all of these in prevention, our existing work with the school districts in our county really address all of these. So I think to me, our work kind of showed up in all of these buckets. And so that's just one thing we kind of, but we had a hard time picking just one because the approach that we have existing actually presses upon all of these.
And I think a lot of these can be combined. So I think if we can get the general vote on, I can add in and combine those and see that piece, but the general vote on what topics, like what areas you want to do, like those top 4. Yes, Mr. Mason.
Yeah, really quickly, I just want to share with you guys what the kind of the breakout room had come up with. And again, I don't mean to diminish any one of these categories. Obviously, they're all important. The ones that we had highlighted in green here are kind of what we had all determined to be our real high priority focus areas. And I wanted to just quickly mention that the ones that we've marked in orange, we felt like are maybe better served by other organizations within our communities. So for example, decreasing the number of prescriptions or decreasing the demand for opioids in general. We kind of felt like this is kind of left up to your doctor's offices and hospitals in terms of making the right choices when it comes to what you're going to prescribe to patients and that sort of thing. So we felt like that was maybe a little bit less out of the abatement council's purview, if you will. So some of these things that kind of, like I said, we've marked in orange. We especially for example, identifying gaps at the BHS facility, we felt like that might be better left up to the Behavioral Health Policy Council. Same thing with providing support for youth mental health initiatives. So again, I didn't want to diminish any one of these things, but I did want to point out that I think that maybe there are other organizations we have within the county, and we don't want to duplicate efforts, if you will. So
Sorry. I appreciate that. And I think this might be good to keep for your guys' next, like another council meeting to kind of talk about how to support those things. If that would work, if you guys could keep that, because I don't have a copy of that.
Yeah, and actually I did, I pasted it in the Zoom chat there. So I think anybody can grab a copy of it if you'd like. And Caitlin, if you want to include that with the record there also, just as far as our group goes.
That'd be good. And I did type your guys' green boxes and put them in the count. So I'm going to kind of share and show the top ones for you guys, and then we could see, are we comfortable voting on that as far as kind of coming up with your top 4, and then knowing that some of those existing things can still continue to be in there, and the funding and everything will be discussed more in depth later. Okay, so these really, I'll kind of go through where you guys can look at those, but the under prevention, the top 2 boxes had 2 votes each. Under harm reduction, the top 2 had 2 votes. And then in treatment, the top 1 had 2 votes, and all the rest are 1 votes. So, yes.
I'm sorry to, So I'm kind of going a little bit with Commissioner Jody Shagnali. On our team, we really, because I hate for some of these things to have one vote when they're really under housing. Like 6 of those boxes are under housing. And then I do like, so I think we need to.
I think we can combine some of these really quick if we want.
And when you said one, the top box, are you referring to?
Up here on the top box. So increasing awareness. So I think as far as like sober living program and housing, you have sober living to help transition to treatment.
We're almost at time, and I don't want to rush us because this is really so important and great conversation. I can throw it out to the table for the voting members that our next meeting, we extend that to 2 hours, and that first half an hour, we come back and we finish this and really have robust conversation, especially because I'm hearing things, and I don't want it to be like the last 4 minutes, everybody blocks out here going, does that sound good?
Yes.
Do you want us to make a motion to pause and table this discussion till next meeting and continue this discussion for the first hour and expand the next meeting to 2 hours? I'll make that motion.
We've got a motion in a couple seconds. All those, any further conversation?
Discussion?
Yes, sir.
I got a question. Does this, so this is kind of the final list. Does this include all our, the ones that were online? Does that
Yes,
include
the
all
green
our?
boxes, yes.
Okay.
Good question, yes. We're going to take all of this and I'll work with Angela.
I think we could combine some to make it a little bit better and then
Much
just be able to
clearer.
have time, because I don't want to cut you guys off either. And I think with the discussions and then coming back, I wasn't sure how it worked, so I
Thank you.
apologize.
Well, that's why-
But
Thank you for that question. Any further questions, conversation? All those in favor, report by aye.
Aye.
Chair report aye. So that's unanimous. Great work. I just didn't want this getting rushed, and it was feeling rushed to me. So we will work on getting out, Caitlin and I will get that out so we all have that block of time for, what's next month, September?
Yeah.
Okay.
And please, can everyone take some pictures
Absolutely, that's great.
with Spanish and English for this program? And I don't know why mine's got all scribbles, but, and then it's got the Connect Effect and QR codes. Would you please take some and stickers and take them out to your community? And, yes, because we're supposed to bring them back and get them across our communities for helping the state. So that's what? The scribbles? Oh, it's on, that's
yes.
Awesome for bringing so many copies. Thank you. Thank you for the conversation. We'll keep this going next month. Motion to adjourn the meeting. There's a motion. Do I have a second?
I'll second.
Got a second? All right, the meeting's adjourned. Great work. Thank you.
Thanks, everybody.
Thank you.
Thank you.
I will reach out. I think there can take
Invoice.
Yes. That's still too to figure. No, I was live across the.
I saw you, Carol.
I'll just bring the pocket off of my thing, so just be honest, and then I'll send it over to you. And then maybe just a chat.
How's me on that?
I mean, we're at 25 minutes time on Wednesday.
Right, right.
And Tuesdays.
It's good.
Okay, yeah, I can look at a time and kind of do that, and then, because I think we can combine some of these, and then.
Great.
You're welcome for more discussions.
And we should.
I think that's good.
Okay, thank you.
Thank you.
I'll let.
Hi.
Good to see you.
Oh, good to see you.
Thanks for participating. Seems like so proud of our regions after being. Football. We're rolling, so.
Yeah, we are rolling.
Yeah. So it's a good- Yeah, that's.
I'm glad we're gonna need to refine.
We're asking the strategy.
Let's go. Cool.
So that's what we were.
And that's what I was trying to say.
So that, I think it's hard to kind of come in and like.
Have a bad habit of missing the emails.
Because Tally.
Scrambling, stop trying to get ahead of the
That
game.
too, it's like, quick, but.
I was like, the time she has lost my
Yeah, right, it's just, so I'll set up a time to meet with. Actually, we can game plan better, hopefully, and we get it done.